Yes, you can.
Today, my speech will be about personality disorders, and it will be on avoidant personality disorder. So, you're going out in public, and you're going to go get some groceries, or you're going to go hang out with some friends, maybe at a park. Usually, you just leave at that. All your interactions with other people may be slim, and it'll just be a simple bump into them or open the door. But once you get home, you usually let it be and you forget about the people that you interacted with or the faces that you saw. But maybe go back in time. Maybe you saw someone who was limping or they had a cane. Maybe someone was kind of pacing back and forth, was a little bit distracted, or a person was mumbling under the breath. They didn't know, they were a bit sweaty, they were kind of in a panic or something. Maybe that first person has a physical disorder. Maybe they have a bad hip, or that second person, maybe that person has ADHD or OCD, and last person may have another personality disorder that gives them a hard time interacting with people out in public. Maybe that disorder could be avoidant personality disorder, where a person has a really hard time interacting with others because they're afraid of what others may think of them. Mental disorders in themselves should be something that everybody should know or have a little understanding of. And knowing people who have suffered personally is definitely a moment where you think about what else happens out in the world. So exactly, what is a personality disorder? Well, according to Mayo Clinic, it is described as a emotion or expression that is out of the norm of a normal circumstance or how supposedly normal people would react. So, it's split up into three groups: Cluster A, Cluster B, and Cluster C, with Cluster A starting off with being odd and erratic. And those consist of having paranoia and schizophrenia. Both are obviously erratic, and they're usually paranoid. So, other words, they kind of have a hard time trying to express themselves. With Cluster B, that'll consist of being dramatic, overly emotional, and unpredictable. So that has narcissism and borderline personality. Narcissism is where you're thinking very highly of oneself, and borderline is where you express multiple emotions or feelings, maybe one after another, almost like two-faced in a way, or two-sided. And Cluster C, which may start to sound familiar and may relate to the third person that I talked about, and that consists of being anxious and fearful, and that can include OCD, and avoidant, and dependent. OCD obviously is where a person has a very hard time trying to focus because they're trying to get this one task or thing done in a specific way. So exactly, what is avoidant personality disorder? In short, avoidant personality disorder is also known as AVPD, and usually a person is described as very sensitive. They are afraid of criticism to the point where they dwell over it and they can't really function properly in life. The descriptions are usually timid, antisocial. They have a hard time having confidence in themselves, and they may have a breakdown out in a public situation or social situations. Symptoms usually are nondiscrete, and you usually don't notice them out and about because they're usually hiding. They're overly obsessed with the criticism that they think that they are receiving. Even though some of these symptoms may seem common or could be minor, we really don't know much about this personality disorder. If anything, according to Cleveland Clinic, we don't know much, and all we know is that it could either be caused by genetics or it could be caused by an outside factor, with outside factors consisting of a abusive childhood or maybe even a difficult time transitioning into adolescence to adulthood. So there are ways to treat your personality disorder, and starting off with the bad, if left untreated, symptoms get worse. You are at a higher risk of abusing drugs and alcohol, and odds are you might fall into depression. And I was lucky to have a friend express what her thoughts were on it, since she personally suffered from it. And quote, "It's gotten worse over the past years, to the point where I don't want to get out of bed, but uncomfortable in bed. Never want to go outside and dislike going out where people are, because I'm more terrified of people. Put on a fake face, and then at the end of the day, I was worn out and just numb." And with depression, it's a spiraling effect. It gets worse and worse, left untreated in itself. So, what's good? The treatments are you can have therapy, you can take therapy, and one of them consists of psychotherapy, and that's where a person focuses on the individual's way of thinking and hopefully have them change over time. And another one is behavioral therapy, and that's where they focus on the behavior and hopefully have their patient slowly have more and more positive thoughts and be in a relaxed state. So, luckily, there was a interview of 15 patients by the National Center for Biotechnology and Information, which is an American library that consists of medical documents, including mental disorders and stuff like that. And between the 15 patients, they seemed to find a common ground in between them. So, one was courage. These people want to have the courage to go out and be able to reach out and get help. They're tired of being held back. And the thing is with this personality disorder, they want to reach out, but that personality disorder draws them back. They want to find trust in people. They want to be able to ask someone for help. They want to have strength in themselves so they can ask someone. And they want freedom from their personality disorder. And they're tired of being managed by avoidant personality disorder. They want to have control of their own life. Even though uncommon and very invisible, and you can't really tell unless you go up to that person, we need to go up to these people and be able to help them out. We should acknowledge them, not just of AVPD, but other personality disorders, OCD, you got schizophrenia, etc. We need to be able to go up to them, be able to help them, and not just leave them with, "Oh, I hope you get better." And with personality disorders, along with AVPD, like I said in the beginning, we should have an understanding of them so we can help others. And the overall goal is to understand, reach out, and give that helping hand. A Bible verse that I absolutely love is from the book of Psalms, and it's Psalms 34:17 through 20. Says, "The Lord hears his people when they call him for help. He rescues them from all their troubles. The Lord is close to the heartbroken. He rescues those whose spirits are crushed. The righteous person's faces many troubles, but the Lord comes to rescue each time. For the Lord protects the bones of the righteousness. Not one of them is broken." That is how we should also treat others. Thank you.